Hi, I'm Christy Turner, Dementia Sherpa. I am your Dementia Sherpa with dementiasherpa.com. Hi, Rachel. Thanks for coming in. I am trying something new today. What the heck? I'm going to do Periscope and Facebook Live at the same time. Hi, Lisa. Thank you so much for coming in. I appreciate it. Hi, Beats. Thank you for coming in. So again, I'm Christy Turner. I am the Dementia Sherpa at dementiasherpa.com, helping guide you through rough terrain. And today I just thought I'd open it up for a Q&A. Hi, thank you for coming in. So you can ask any questions you might have about how do you pull that off? How do you get someone? Hi, Keisha, thanks for coming in. How do you get someone who's living with dementia to go to a doctor's office? Because we know they don't like that. That's one of the toughest things that you'll probably ever be able to pull off. So a lot of times I give advice about that. In fact, I wrote a blog post about that this week, but still people have questions like, all of that sounds great, Christy, but what about my specific situation? So I thought, hey, why not ask your questions, right? So again, I'm Christy Turner with dementiasherpa.com or at Dementia Sherpa. I'm your Dementia Sherpa guiding you through rough terrain. Hi, Sherry. Thanks for coming in. I know that this is really rough terrain because I've helped 1,045 people living with dementia and their family members. That's a lot of people, and that's a lot of people who've been through really rough terrain. I've also been through this 7 times myself in my own family. So 5 grandparents and 2 people that I served as professional guardian for. To me, that's kind of like elder adoption. They became part of my family. So 7 personal experiences and 1,045 experiences professionally. So I've been doing this for 15 years. And what I have found is that typically it's a lot harder at your house than it has to be. Obviously, I've had lots of opportunity to practice, to refine my techniques, to really figure out what works and what doesn't work. You probably have not had that same experience. Most people, the max that they've had the experience with is maybe 2 parents and 2 in-laws, which is a lot. You definitely know a lot more the 4th time than you do the 1st time, but please, I invite you to take advantage of the experience that I've had so you don't have to struggle as much, because I still remember my very first day as a professional. Oh my gosh, my gut was churning. I was freaking out. It's horrible when things don't go the way you're hoping that they're going to go. So Lisa says, my 78-year-old dad lives with me, and over the past 6 months, I'm sorry, Lisa, I lost the last part of that. If you could put that up again. And thanks for coming in, Lisa, by the way. So the gist I'm getting is that your dad is living with you and has memory loss. So if you could fill in the blanks for me there, I would be happy to answer any questions you have. This is about how do you get someone to go to a doctor's office appointment, but please feel free to ask any questions at all related to dementia. I'd be happy to answer them. Notice that he has short-term memory loss. Okay, so that happens definitely when we're talking about dementia. Do you suspect that he has dementia, Lisa? Thank you for the hearts. I appreciate it. It's really bad. Okay. All right. But he doesn't have a diagnosis yet? Is that right? So a lot of times that's something that's really difficult to get, that diagnosis, because it turns out that people don't want to go to the doctor's office. If you think about it, most of us don't want to go to the doctor's office either, right? It's just one of those things we don't put up there as fun things to do. Especially when it comes to dementia, excuse me. The reason most people don't want to go to the doctors is because it is, if we're talking about dementia, we're talking about a disease that is without a cure. It's chronic, it's progressive, and ultimately it's terminal. So nobody's thinking, yeah, let me run out and get that diagnosis. Forget it. No way. But The reason it's important is to know that that's actually what it is versus something that is appearing like that, but is actually treatable and resolvable with other treatments. So that's why a diagnosis is really important. Lisa Nichols, you said that that your dad has bad short-term memory, but really good long-term memory. That is very common for people living with dementia. And the reason why is how our brain processes information and how it makes memories. So that first information in is the last information out. So exactly the opposite of how you do it in the produce section at the grocery store. So should I talk to the doctor first by myself? I think that is probably a good idea. What I recommend people do is go ahead and either call the doctor's office or send an email. It depends on, your doctor, but one of those two ways is a good way to go about it. Understand there's something called HIPAA, which is confidentiality. I'm going to give you the very condensed version because it's actually kind of boring, all the technical details in it. But basically it means if I go to the doctor, I have the choice of who gets information about that visit. Now, typically, I'm going to say nobody. It's my business, right? Some people, though, have a power of attorney for healthcare, or it could be called a healthcare proxy, or they can just designate on that HIPAA form who they can share information with, who the doctor's office can share. Good. That's great that you're in that position, Lisa, where you're able to have that open conversation. So for people who are not that lucky, here's what you can do anyway. You can still call the doctor's office. You can still send an email or a letter, and just understand they're not going to talk to you about it, but you can still share your concerns. That's perfectly okay. One of the weird things that can happen when someone's at a doctor appointment is, especially if they're accompanied by a loved one, you go into the appointment, let's say that I'm there with my grandpa, right? And the doctor, instead of talking to my grandpa, like he's right there, talks to me, like my grandpa is suddenly a piece of furniture. Isn't that weird? So sometimes you have to give the doctor a little guidance of, hey, look, I brought Dad with me too, and it's his appointment, so why don't you go ahead and talk to him? That doesn't mean that we want the doctor to talk about like, so I understand you think you have dementia, because really most of the time, the person who is there for those concerns does not think that he or she has dementia. About 80% of people living with dementia have no idea that they have a problem. It's another condition called anosognosia, and what it is their brain is telling them they're fine. They don't have a problem. They have no insight into any loss of abilities that they have. So this is why using reason and logic does not work ever, because they're going to believe their own brain rather than you, right? How do the doctors test for that? That's a great question, Lisa. So when someone is diagnosed with dementia, it is a diagnosis of exclusion. Okay, and I mentioned earlier there are some conditions that masquerade as dementia, and we want to get those treated. So that's the first step, is like figuring out what else could it possibly be that's treatable. So I'm going to give a few examples here. Impaired thyroid function interferes with memory, so we'd want to look at that. Believe it or not, constipation, dehydration, urinary tract infection, all of these things can cause confusion and impaired memory. So if any of those are issues, we'd want to get those resolved. Vitamin deficiency, vitamin B12, folate deficiency, also can masquerade as dementia. Also very treatable. Now, sometimes we find that somebody does have a thyroid problem, they do have a vitamin deficiency, they have been struggling with constipation, all of those issues get resolved, there's still a problem. So that can happen too. I don't want to in any way be throwing out false hope, okay? There can still be a problem, but the symptoms of the memory loss and the confusion will get much better when these other conditions are also treated. Another big thing is depression or grief. Those can also make it appear in someone who does not have dementia as though they do. And if anybody has been through an experience of grieving someone close to them, it's kind of like being in a fog and you can't remember really what just happened or a conversation that you just had or that you're supposed to be someplace, and yet other things stand out in your mind very clearly. That's grief. It definitely affects your brain, as does depression. So in both of those situations, it can appear that someone has dementia, but they don't. So we get that testing out of the way. So that could be a contributing factor there, Lisa, in the situation that you're describing. Absolutely. So we get the kind of the blood work, that piece taken care of. And then another part of the testing is an MRI or a CT scan to see, is there something going on in the brain? Has someone had a stroke? Or do they have a brain bleed? Or is there a tumor? Or whatever it may be. Is there loss of blood flow? So we're looking at all of those types of things. And then I recommend going to a neuropsychologist, not a neurologist, a neuropsychologist. Typically with a neuropsychologist, first of all, they're trained in doing this type of testing. Second of all, it's extensive. So it's going to be an accurate diagnosis. Hi, Alexis. Thanks for coming in. So that's really important, right? An accurate diagnosis. We don't want someone making their best guess. We want to know specifically and accurately what's going on to the best of their ability. Most times now, we can get probably about 90% accuracy in a diagnosis while someone is still living. The definitive diagnosis can only happen at this point, at the point of autopsy, right? So we can actually see what exactly is going on with the brain. But there's so much awareness about dementia and the different types of dementia now that accuracy in some cases is even as high as 97% in living people. So that's a good thing about there being a lot of awareness about what's going on. In any case, no matter what the specific diagnosis is, the reason that it's important to find out what's really going on early on is so these other issues can be treated if they're present. And if in fact it is dementia, then we know we're going to need to do some planning for the future, right? So at a certain point, somebody's not going to be able to live independently. They're not going to be able to manage their finances. We need to have an idea of how we would handle a crisis. If they were in an automobile accident, let's say, and they were fairly far along in the disease process, right? What would we do? Would we go for all the bells and whistles in the ER to try and save their life, or would we make different choices? So that's what I mean about planning for the future. This is why a diagnosis early, as soon as possible, is really important, because we want the person who has the diagnosis to be able to be involved in making those decisions to the best of their ability as much as possible for as long as possible. We also want them to stay as independent as possible for as long as possible. Everybody with me and making sense here? I hope. So that's why you zip off to the doctor's office to get a diagnosis, even though, of course, we don't view it as good news. He has me on his bank accounts, and we're getting an attorney to update his will and living will. That is excellent, Lisa Nichols. That is excellent. That's exactly what you should be doing. Elder law attorneys are particularly good at this. I recommend them versus just an estate planning attorney. The reason why is there's that gap between I'm fine now and I die, right? And when we're talking about a chronic, progressive, terminal, incurable illness, that can be a gap, right? And so elder law attorneys always focus on that gap and what they can do. They're always looking at the worst case scenario and how do we plan for that. So it's kind of like being a Girl Scout, really, right? Being prepared for everything. That's the specialty of what they're preparing for. So it can have a really serious financial consequences if that part isn't handled correctly. Another thing, another good reason to go to the doctor is because you want to decide, do you want to use medications in the course of this disease process? There are right now only 4 medications that are actually approved for use for people living with dementia, specifically for dementia. And they're really, 3 of them are only approved for Alzheimer's disease, but typically they're used for most types of dementia, most causes of dementia. So 3 of them are in the same category, 1 is in a different category. That's really important to know. For people who have Lewy bodies dementia or Parkinson's related dementia, we're going to want to use a specific drug. And then there are some medications that are fairly commonly used that are really, really bad for people living with dementia. It makes their symptoms worse. It makes it harder for them to communicate. It can increase their risk of having a stroke, their risk of having a heart attack, their risk of falls, their risk of a hip fracture, which increases risk of death. So there are certain things that we want to stay away from. So again, these are all really good reasons to get to a doctor, get an accurate diagnosis as soon as possible. Reagan Black, oh my gosh, we have a USA Today best-selling author in the house. I feel so special. Thank you so much for coming in. Appreciate that. And sharing on Twitter. Thank you, thank you, thank you. So those are all reasons why it's important to go to the doctor, even though you fear you're not going to get a great diagnosis. He has so many health problems, so we've been trying to stay on top of everything. Yes, that's really a good idea, Lisa, because you want to have kind of that cohesive plan for moving forward, right? So you're not, because honestly, there is nothing worse than being smack in the middle of a crisis and trying to figure out what to do. And it doesn't matter, I mean, we can put this on any type of crisis, right? It sucks. You do not want to be in a crisis. I've been in several myself where, you know, somebody said, chicken or fish is too crazy a choice to make, let alone life and death type decisions. So please don't let yourself end up in that type of situation. Just plan ahead. And then you don't have to think about it so much later, right? When you are in the midst of a mess. So great questions, Lisa. Thank you very much. Hi, 1 year of single. Thanks for coming in. Hairball. Holy cow. I can go all day without a cough and then, you know, go live on the internets and so I am answering questions about how to get, for absolutely, Lisa, anytime, how to get someone to go to the doctor. Hi, Princess. Thanks for coming in. How do you get someone who's living with dementia to go to the doctor, or any other questions you have related to dementia? I'm happy to answer those. My name is Christy Turner, for anyone who may not know me, because right now I think it's just my friends in the room, but could be somebody else. So I'm Christy Turner. I am at Dementia Sherpa. I'm your Dementia Sherpa, guiding you through rough terrain because it's really tough. This disease process is hard enough without any added layers of difficulty here, right? Well, thank you, Alexis. I appreciate that. Thank you for coming in. So I'm answering questions, Alexis. If you have any, feel free to throw them out there and I'll do what I can to help you. I have been working with people living with dementia for 15 years now, and thank you, Reagan. I have worked with 1,045 people living with dementia and their family members. I've done that professionally, and then in my own family, I have 5 grandparents who died of various types of dementia, and in my professional capacity, I served as guardian for 2 other people who had dementia diagnoses, and so to me that was like elder adoption, so they became part of my family. So 7 personal experiences, over 1,000 professional experiences. Thank you so much, Reagan. I appreciate that. Hi, Fiona. Thanks for coming in. So that's where I get my experience, and I definitely remember how tough it was when I first started out, and I always call it the gut churning moment. Actually, I'm going to be honest, so plug your ears if you can't stand any PG language, but I always call it the oh shit feeling, because oh my god, to have something going sideways, you have an unhappy person living with dementia that like the king of planet unhappy, and you don't know what to do. Oh my gosh, that is the worst feeling in the world. Hi Angela, thanks for coming in. So I am happy to answer any questions you might have specifically about your situation. How do you get your loved one to go to the doctor? Or maybe that's not even a concern. You're like, yeah, I got that. But it's this other thing that's going on, which is totally fine. Ask that question too. Hi Nancy, thanks for coming in. So I am open to any questions you might have about dementia or managing a specific behavior or medications, or I don't know, you tell me, because I'm like a wind-up toy. I could keep talking. Hi Angela. And if you haven't had a chance to check it out, like I said earlier this week, I did publish a blog post on this specific topic with 10 ideas about how you can get your loved one to go to a doctor appointment. And that is at dementiasherpa.com/DrAPPT. Yes, I abbreviated appointment, but I didn't abbreviate doctor. I don't know what I was thinking. But dementiasherpa.com/DrAPPT. Is it normal for me to be a little bit in denial about my daddy? I think you said he's the only parent I have. Is it normal? Okay. You know what? We're all here. We're among friends. I'm going to be 100,000% honest here. Yes, it is 100% normal. And let me tell you about my family situation. So, my dad died in August last year, unexpectedly. I'm a total daddy's girl. And that was the one thing my entire life that I dreaded, was anything happening to my dad. And he had a history of cardiac problems. So the last 19 years of his life were really like bonus time. And we were lucky enough to know that because in fact he had had a cardiac arrest 19 years before he died in front of me and my mom. We were there, and that's actually why he ended up living through it, is because of the immediate action. So that caused, he was out long enough that caused some damage, and he had severe short-term memory loss for about a year, and it did get better. But he was never exactly where he was before, and in the last probably 5 years of his life, he was concerned about his memory and talked to me about it. Obviously, he knows what I do, and I can tell you it's different when it's your own family. I didn't want to hear that. I didn't want to know that. And for, the reasons, because I've seen so much of it myself, of course, I didn't want him to go through that. And I don't want anybody to go through that. But I didn't want my dad reliving his childhood, because it wasn't a childhood that anybody should ever have to go through once, let alone twice, right? So I was pretty much in denial about how his memory was going. And coming into his office after he passed, he had probably 3 bookshelves full of memory products, like how to improve your memory, like books and videos and things like that. It was a really serious concern of his. And you know what? I still feel really bad that I didn't have an open conversation with him, the conversation that he wanted to have with me, that I kind of gave him the pat on the head of, oh no, you're okay. And I knew better, but it was because it was my own stuff. I guess couldn't go there. So I say, Lisa, it's very normal. It's very normal. And I think not just even with dementia, but really with anything. We don't want to see people we love struggling, and we don't want to see them going through a difficult situation, and especially again when we're talking about something that's chronic, progressive, incurable, because it doesn't feel good. But what you're feeling is completely normal. Yeah, Reagan, we do. We all have those limits, especially with loved ones. And so on the professional side of things, that is typically where I'm working with families saying, I know this hurts. I know your heart is breaking, but we still got to deal with it because the reality is XYZ. These things are going to happen. These decisions need to be made. So there's all of that. That's kind of the overarching theme, but I would say to me, what's even more important, what I feel is like the big overarching theme. Hi, thank you so much for coming in, KML. Is, we have right now, and if you think about it, this is beyond dementia even, right? We have right now. I'm not guaranteed to wake up tomorrow morning. I could, but maybe not so much. So we have right now. Let's make the very best of what time we do have right now. Dementia has this reputation for being this awful, horrible, difficult thing to deal with. And it can be. But you know what? It can also be, yes, Nancy, live for the moment. It can also be so much more manageable than it is than probably is what is happening in your situation right now. And it's just some things that we do differently. We just need to take into consideration, and all of a sudden, things get a lot better. Very good point. As caregivers and family, we can make the most of the time we have. Yes, absolutely. So is anybody picking up what I'm laying down? Is this making sense? That's why I'm here. I'm glad I got him to move here with me. Yes, it sounds like that's a good situation there, Lisa. My dad, some dementia at the end stages of cancer, was aggressive and mean then. I'm sorry I didn't catch everything that you said, but yeah, it can be really tough. It absolutely can be really tough. One of the words I caught that you put up there was mean. My dad could be really mean. And I'm not saying anything about your situation because it went by a little bit faster than I could read, but I have worked with many people who have been in that situation when they're like, you know what? I can't handle this anymore because my mom is just so damn mean and I can't take it. Okay, I totally get that. So one thing that I always say, let's look for this. Let's see what's behind it. It could be that she's in pain. And one of the things we don't think about is that people living with dementia have really a lot of difficulty saying that they're in pain. And in fact, most of the time, if they're asked if they're in pain, they're going to say no because they've learned no is their safe word. So it doesn't get them into weird situations that they don't understand. Like, do you want to take a shower? No, that's a safe word, right? So they don't want to do that. So a lot of times, just a couple of Tylenol, say 3 times a day, can just, it's miraculous. It's like, wow, she was so mean and now she's a doll again. So that's, pain is definitely something to look at. The other thing too is that usually with dementia, you get more of what was there in the first place. So if somebody lifelong has just been a total doll and somebody you would have loved to hang out with, even if you weren't related, you're likely to get more of that. You're just going to see more of that. If someone was kind of not so nice, or you historically had a really difficult relationship, you're going to get more of that. I'm sorry to have to tell you. And the reason why is because our frontal lobe, which is just right behind your forehead here, okay, all the way across, that's your frontal lobe. And it is our self-editing feature. So it controls, let's say it's 105 out, which blessedly it's not at my house, but I know some of you people live in the Carolinas, and it's miserable there, right? So This, the frontal lobe, the intact frontal lobe, is what keeps you from going, you know what, it's 105 or it's humid, it's not, so I'm just going to take all my clothes off, even though I'm in the middle of the Piggly Wiggly. That is a loss of self-editing feature, right? So, or yeah, Tennessee, the humidity is probably not so awesome there right now either. So when somebody is living with dementia, that starts to disintegrate. And so people will blurt out whatever happens to come to mind, or they will do things that to their brain makes sense, which is, I'm too hot, I'm going to take clothes off. Duh, right? Or, and I've been the target of this. I'll never forget, very early on in my career, actually this was my very first day as a professional, I bent over to pick up a ball that had gone flying by, a beach ball that had gone flying by because I was running a game, an exercise game, and it went flying by me, so I ran over and bent over to pick it up, and this lady, Ethel, who everybody swore couldn't speak. Oh no, she doesn't speak. She hasn't spoken in years. Well, Ethel got the miracle of speech back in that moment. And the acoustics in this place, holy cow. So Ethel screamed at the top of her lungs, look at the size of her ass. She's talking about me. So, hey, thanks Ethel. That's great. Miracle of speech. Woo! So that's frontal lobe disintegrating. That's what you get. And so people lose any diplomacy skills that they may ever have had. Yeah. So that happens. And that's just how it goes. I had one of my grandmas was just a total sweetheart. Oh, good. I'm so glad, Lisa, that you're finding this help. No, don't be afraid to ask questions. Ask away. So one of my grandmas, who's just a total sweetheart, this is my mom's mom, just a doll, just a complete doll. Hi, Shelly. Thanks for coming in. She was just always so elegant and so sweet, and my mom's personality is just like hers. My mom's just so sweet. So my mom took my grandma to the doctor's appointment, and my grandpa was there too. And the doctor was worried about her weight loss. And so he said to my grandma, you need to gain some weight. You need to eat more. And she wasn't that excited about that idea. And he said, well, you like pasta, don't you? You need to eat more pasta. And she turned to my grandfather and said, you son of a bitch. I always wanted to go to Italy and you never let me. Now, this never had come up. Italy had never, ever, ever come up. But for whatever reason, apparently she had some deep-seated desire to go to Italy, but that frontal lobe was being affected, self-editing feature gone, and so that's what spewed out. Now, that was like as bad as it got with her. I mean, because she was just a total sweetheart, but, it happens. So when your hubby starts to write notes all the time, Nancy asks. Okay, so let's get really specific here, Nancy. Are we talking about writing notes and losing them? Or, yeah, Reagan says she's been on the receiving end of those types of conversations with her mom. No, you're not alone, Reagan. Hi, MBA. Thanks for coming in. Oh, MBA not required. Excellent. Hi, Shelly. Thanks for coming in. So the question is, you know what? Shoot. Ask the question again, because now I'm thinking about my grandma yelling. Writing notes. Yeah, thank you, Nancy. So are we talking about a prolific amount of notes, or, writing notes and leaving them all over the place and forgetting that they're there? Or are we talking about, I'm going to write this information down so I don't forget it, and kind of keeping that list with him throughout the day? Which, can you kind of clarify on that? And I'll just give you, everybody, kind of a quick example. So, because people go, oh my God, I forgot my keys. Does that mean something? Here's how you think about it, okay? So if you lose your keys, that happens to all of us, right? Thanks, Reagan. Thanks for coming in. I appreciate it. That's not a problem. We all forget our keys, right? From time to time. So you kind of walk yourself back through, okay, what happened here? That's okay, Shelly. I appreciate you coming in. Hi, Lisa. Bechtel, thanks for coming in. So if you lose your keys, that's not a big deal. It's if you lose your keys, then you find your keys, and you have no idea what your keys are for. That's a problem. Okay, does that make sense? Put a 1 in the chat stream if that makes sense to you. Okay, so there's a difference there. Okay, thank you so much for sharing, Lisa. I appreciate that. So with the notes, Nancy, that you're talking about, your husband's taking notes and lists that he's keeping with him all day. I do that. A lot of business owners do that, right? A lot of people do that. They have their task list for the day. And I think that you know that. So I feel like there's something else behind your question. Like maybe it's not just taking notes, or maybe it's the length of his list or something like that. So if you can give me something a little bit more specific, then maybe I can come up with a better answer. But I feel like there's kind of a little bit something underneath there, rather than just keeping a list. So keeping a list of things to do is normal. A lot of people do it. I personally, if it's not on my list, not on my calendar, it's not happening in my day. So I think that's totally normal. Any other questions for anybody who came in and doesn't know me, which might be some people? I'm Christy Turner at DementiaSherpa.com. At Dementia Sherpa is my handle on Twitter and Periscope and Facebook and all the social medias, Dementia Sherpa. And I'm your Dementia Sherpa. My mom had a brain aneurysm, now has some short-term memory loss. Okay, Alexis, so that would be completely normal. Has she had a CT scan where you can kind of see what's been affected? Oh yeah. Yes. Okay. So there, in that type of situation, typically we're looking at there's a part of the brain that has been affected or dies because of the blood loss for that particular area. So depending on where that is, another part of the brain may be able to take over those functions, but don't know what was the effect wasn't there for that. Okay. Are you a long distance care partner? Do you live away from your mom where you're kind of relying on someone else to get the information? That can be really tough to be long distance for sure. What about if they change the story about an incident? It's a new action for my mom. No, we live together. Okay. Okay, so if you're able, Alexis, then you might want to go to those doctor appointments in the future to help you kind of stay on the same page and know what's going on and be able to be a good advocate for your mom. Lisa, can you throw your question up there one more time? I'm sorry, it was a good question that I think is helpful for a lot of people, and I can't remember what it was. Babs14, thanks for coming in. I appreciate it. I am Christy Turner, DementiaSherpa.com, your Dementia Sherpa, guiding you through rough terrain, here to answer any questions you may have. Thank you so much for coming in. I appreciate it. And I cannot believe I've been on this long. Okay, that's good, Alexis. So she no longer drives. That's so important. That's one of those things that I think might be a good topic for a future scope is what do you do about the driving thing? Because some people really struggle with that. Things that may happen if she changes what actually happened. It seems to be a new trend. Okay, Lisa, I think if I'm remembering your original question correctly was you were saying like something happened, but then her story about what happened changes later. Is that right? Okay. So there's a blog post I did, I think it was about 3 weeks ago on this, and I actually have a special guide to it. Okay, I will add that to the list, Alexis. I think that is a good one. Thank you, Nancy. So there's something called conflation and confabulation. Okay, so what that is this brain that is completely under attack, right? So it's not just memory, it's so much more than that. That you have a brain that's under attack, is trained to figure out facts, right? So, okay, I know this fact from over here and this fact from over here. Now I'm going to add them together and make up a new fact. And you will never, ever, ever be able to convince me that I'm wrong, because my brain is telling me I'm right. And that's what's happening. So that's a no-win situation. You're never going to win it. That's a scope about arguing. So we will add that to the list. But that's what's happening. And the most important point I can make about that, Lisa, is it is not intentional. There is zero malice involved. It is just as much like when you look in the mirror and say, my name is Lisa. I have short hair. I do scopes at the beach every morning. Those are facts that you know to be true. That is the evidence around you that tells you this is true. So what's happening there is something different. And, Lisa, call me anytime, honey, and, we can have a conversation about this. If there's something, if this is a new and dramatic change, I definitely recommend you want to make that doctor appointment happen, okay? Because sudden changes are not normal with dementia. Okay, my special needs lady has started wetting herself. Her answer is she forgot. So she may be losing the ability for continence. Okay, great, Lisa. Thank you. So Shelley, that's a normal part of the disease progression is the loss of continence, okay? But one thing that you can try, because you don't just have to say, oh, well, that's just how it goes, is you can try a toileting plan, which would be where you are every so often, usually about every 2 hours or every 4 hours, depending on what the situation is, just saying, hey, let's go in here to freshen up. And you just take her into the bathroom, and it's that good old try, hey, we're here now. Let's just give it a try and see what happens. And a lot of times that can be helpful. Another thing that could be causing it is urinary tract infection. Those bladder spasms can lead to a loss of continence also. So, thank you guys. Appreciate that. No, you're already doing a toileting plan and it's not a UTI. Okay. So, and she has a diagnosis of dementia. Is that right, Shelley? Just throw one up there if that's true. So probably, what you're describing sounds like, no, she does not have a diagnosis of dementia. Do you suspect that that is part of the diagnosis or part of a medical issue that she might have? Because you did say special needs, but I'm not clear on the diagnosis, and I know that you can't share that. But you think it is happening. Okay, so it could be happening. There would be some other things that would be happening too if it is dementia. And so I'm going to point you back to, let's see, I'm trying to think, do I have it on my blog? Maybe I don't. Shelley, just send me an email, okay? It's Christy, CHRISTY, at ctcdcm.com. Send me an email or, DM me on Facebook, whatever, and I will get you a tool so that you can figure out what's going on, okay? So it's a scale, and you can pick out some situations that are happening, and then you can figure out like, oh, okay, I think this is consistent with dementia, or like, nah, that's not it. There's something else going on, so you know what kind of follow-up you need to do. Okay, holy cow, I've been on here for 45 minutes. Trying to overcome like 45 hairballs because, I'm fine during the day until I'm live on video, and then so thank you all so very much for coming on. I truly appreciate it, and would love to see you on a scope anytime. Always reach out to me. I'm happy to answer any questions. Thank you so much for completely awesome questions and helping make this a great experience for me. I hope it was a great experience for you. You can find me at Dementia Sherpa on Twitter, and I started to say Pinterest. We're not on Pinterest. We're on Periscope. So I appreciate it so very much. Thank you all. And please remember, you are never, ever alone. You're really not. I am happy to guide you through rough terrain and help do whatever I can to make this an easier journey for you. Thank you. never can figure out